So, a patient who has been taking large quantities of aspirin might show increased post-operative bleeding because aspirin inhibits the synthesis of thromboxane A2 and prevents platelet aggregation. The first fact you must remember is that aspirin prevents platelet aggregation. So, next, anti-inflammatory agents such as aspirin interfere with hemostasis by answer again inhibiting platelet aggregation. Which of the following anti-inflammatory agents does not act primarily by inhibiting the activity of prostaglandin synthetase? Well, this is a question which you have to memorize because you will not. You will have to memorize this. Um, which of the following anti-inflammatory agents does not act primarily by inhibiting activity of prostaglandin synthetase? So the answer is triamcinolone. Triamcinolone, which is a corticosteroid, and corticosteroids are not don't inhibit prostaglandin synthetase. So let's look. Triamcinolone. We're gonna see um, board busters about triamcinolone. So triamcinolone can be used as a topical corticosteroid for treating oral lesions, especially they're effective for treating oral lesions along with Kinolog in Orabase. So triamcinolone, RF, and Kinolog in Orabase are effective in treating the oral lesions. Um, so it can be used in patients with pemphigus or pemphigoid or psoriasis, which uh, are conditions in which there is need of systemic steroid therapy. So the topical corticosteroids, triamcinolone, Kinolog in Orabase, and effective in treating the oral lesions. So triamcinolone is a synthetic corticosteroid, actually synthetic glucocorticosteroid, glucocorticoid. So glucocorticoids have important effects on carbohydrate, lipid, and protein catabolism, immune responses, and inflammation. So it can be used as an anti-inflammatory agent. The majority of anti-inflammatory and immunosuppressive actions of the glucocorticoids are the results of their action on arachidonic acid metabolism. They induce the synthesis of a protein that inhibits phospholipase A2, which decreases the production of leukotrienes, of prostaglandins and leukotrienes. Okay, so the question says, which of the following anti-inflammatory agents does not act primarily by inhibiting activity of prostaglandin synthesis? Triamcinolone, because you have to know that triamcinolone is a corticosteroid. It's actually a glucocorticoid. And corticosteroids inhibit phospholipase A2, the enzyme step that precedes prostaglandin synthesis. Diflunisal is a silate analgesic like aspirin. So, prolonged use of which of the following drugs does not cause predisposition to gastric irritation and bleeding? The options are phenytoin, ibuprofen, indomethacin, phenylbutazone, and acetyl salicylic acid. This is a straight drug identification question. This is a straight drug identification question. Answers do, 2 to 5 are not all non-steroidal anti-inflammatory drugs which cause gastric irritation and bleeding due to their effects on prostaglandin synthesis in the mucosal wall on the gut. Prostaglandin synthesis in the mucosal wall on the gut. Phenytoin is an anticonvulsant. Its major rule effect that often appears as a question in boards is the production of gingival hyperplasia. Phenytoin is the right answer because the question says prolonged use of which of the following drugs does not cause a predisposition to gastric irritation and bleeding. Which of the following anti-inflammatory agents does not act primarily by inhibiting activity of prostaglandin synthetase? The answer is triamcinolone. Triamcinolone is a corticosteroid, a synthetic glucocorticoid. Corticosteroids inhibit phospholipase A2, the enzymatic step that precedes prostaglandin synthetase. Diflunisal is a salicylate analgesic like aspirin.
So triamcinolone is also is kinolog. Triamcic no Triamcinolone is kinolog, topical steroid suggested to relieve aphthous ulcer symptoms. Triamcinolone kinolog is used in Orabase at 0.1%, 5 milligram tube. So triamcinolone triamcinolone does not act on the prostaglandin, just like prednisone and hydrocortisone. They actually inhibit the enzyme phospholipase A2. Phospholipase A2 is um, phospholipase A2 is okay. Next question. Each of the following agents has been associated with gastric irritation, except acetaminophen. Note the difference in this question and the one we read before is that this one's acting about, okay, we gotta read number 11 first. A non-steroidal anti-inflammatory agent that appears to produce fewer gastrointestinal disturbances at high doses of aspirin is ibuprofen. You might be tempted to answer acetaminophen because it doesn't cause GI upset, but remember it is also non-anti-inflammatory. The answer is ibuprofen. Tricky. You have to you sort through two distinguishing characteristics. So a non-steroidal anti-inflammatory agent that appears to produce fewer gastrointestinal disturbances than high doses of aspirin is ibuprofen. Why? Because you can think of acetaminophen, but acetaminophen is not anti-inflammatory. So it's a tricky question. Ibuprofen would be the answer here because ibuprofen reduces the inflammation, it's non-steroidal, and is the one out of all the NSAIDs that produces the fewer gastrointestinal disturbances. Next, each of the following, okay, which of the following is not produced by excessive doses of acetyl salicylic acid? Hypothermia. It lowers your temperature if you have a fever. Taking aspirin does not have any effect on body temperature in the non-feverish patient, but high doses can cause all the other effects listed, which are metabolic acidosis, hyperventilation, tinnitus, and delirium. So, aspirin will not be produced. Aspirin will not produce hypothermia in any amounts. You just have to remember what is the mechanism of action and how it works to reduce uh, fever, and it only dilates vessels in the surface of the body to let heat um, dissipate. It does not have an effect on central nervous system. Next, all of the following are pharmacologic and toxicologic properties of aspirin, except one. Which one is this? Tinnitus, yes. Tinnitus, yes, it can cause tinnitus. Tinnitus. Analgesia, yes. Salicilism, yes. Antiparesis, yes. Suppression of the immune system, no. It does not cause suppression of the immune system. Next question. Therapeutic effects of aspirin include the answers are analgesia, tranquilization, diuretic action, anti-inflammatory action, anti-rheumatic action. Okay, so the answer is it helps on analgesia, not in tranquilization, not in diuretic action, because it doesn't increase the heat. It has no anti-inflammatory action, and it has no rheumatic action. I mean, yes, no anti-inflammatory action in aspirin, no anti-rheumatic action, and no analgesia. All of the following are pharmacologic or toxicologic properties of acetyl salicylic acid, except methemoglobinemia. So all of the following are pharmacologic or toxicological properties of acetyl salicylic except one. Tinnitus, tin I don't remember how to say that. Let's see. Let's see how to say tinnitus. Tinnitus. Pronunciation of tinnitus. Tinnitus. Just tinnitus. So, all of the following are possible effects of aspirin. All of the following are pharmacologic or toxicologic properties of anti-acetyl salicylic acid, except first option, tinnitus. Yes, it does. Tinnitus is associated with aspirin. Next, analgesia, yes. Antidepressants, yes. Methemoglobinemia, no. And inhibition of prostaglandin synthesis, yes. The only one that is not associated with aspirin is methemoglobinemia. Next, all of the following are possible effects of aspirin except one. All of the following are possible effects of aspirin except reduction of fever is not correct because aspirin does cause reduction of fever, also causes suppression of inflammatory response, bleeding from gastrointestinal tract, increase in the renal excretion of uric acid at high doses. It does not, however, it, it doesn't have an effect of shortening of bleeding time. It increases the bleeding time. Next question. Of the following, aspirin does not cause suppression of the cough effect. So, of the following, aspirin does not cause occult bleeding, nausea and vomiting, acid-base disturbance, suppression of the cough effect, decreased tubular reabsorption of uric acid. All of those are caused by aspirin. The only one that is not caused by aspirin is the suppression of cough effect. So aspirin does cause bleeding, stomach bleeding. It can cause nausea and vomiting. It can cause acid-base disturbances. It can cause decreased tubular reabsorption of uric acid. So an explanation of this is suppression, I mean, occult bleeding and nausea and vomiting are the major side effects of aspirin, resulting from the inhibition of prostaglandin synthesis. For the majority of people, and one reason for the popularity of aspirin alternatives such as acetaminophen and ibuprofen, which produce these effects to a lesser extent. Also, number 3 and 5, which are acid-base disturbance and the decreased tubular reabsorption of uric acid can be associated with it, but these are associated with following larger doses of aspirin. So large doses of aspirin can cause acid-base disturbances or decreased tubular reabsorption of uric acid. Okay, so with larger doses of aspirin, you may see acid-base disturbances and decreased tubular reabsorption of uric acid. Um, Now, what is not seen with aspirin? The suppression of the cough effect. The suppression of the cough effect has nothing to do with aspirin, but is a major therapeutic use of narcotic opiates such as codeine. Codeine is a suppressor of cough effect, cough, um, reflex. They are hoping in this question that you will get the effects of codeine and aspirin mixed up, since the two are often compared and contrasted as moderate pain relievers. Okay, next question. Which of the following is not true about acetaminophen? Acetaminophen, okay, which one is not true? We have a list of options here of many facts about acetaminophen, and one of them is not true. So, first, acetaminophen is a non-prescription drug. Yes, it is a non-prescription drug. Acetaminophen is cross-allergic with aspirin. No, it's not cross-allergic with aspirin because acetaminophen is not a salicylate with the other. Okay. Next is uh, acetaminophen possesses both analgesic and antipyretic effects. Tylenol, yes, Tylenol has both analgesic and antipyretic. Acetaminophen may induce methemoglobinemia at high doses. I guess it does. And acetaminophen may be a pharmacologically active form of acetophenetidine, I guess, phenacetin. So, acetaminophen may be a pharmacologically active form of acetophenetidine or phenacetin. Acetophenetidine, acetophenetidine, acetaminophen is a pharmacologically active form of acetophenetidine, and it may induce methemoglobinemia at high doses. So let's look acetaminophen. And methemoglobinemia. So oxidative stress from acetaminophen overdose can cause other untoward effects such as methemoglobinemia. Methemoglobin is the oxidized form of hemoglobin where the red blood cell bears iron. It is covered in the ferric state. So methemoglobinemia and hepatotoxicity characterize acetaminophen toxicosis. Renal injury is also possible. Cats primarily develop methemoglobinemia within a few hours, followed by Heinz body formation. Methemoglobinemia makes mucous membranes brown or muddy in color and is usually accompanied by tachycardia, hyperpnea, weakness, and lethargy. So, okay, so where was I reading that? Okay, next question. Which of the following is not true about acetaminophen? It's not, it is true. Oh, I read this already. I was in which of the following is not true regarding acetaminophen? It, it has antipyretic properties. It does. This is, you're looking for the one that is not correct. It is correct that acetaminophen has antipyretic properties. Also, it is correct that it may induce methemoglobinemia. Also, it is correct that it can be combined with codeine to make Tylenol 3, 2, or 4. Again, no, Tylenol 3. It has anti-inflammatory properties. It does not have anti-inflammatory properties, acetaminophen. And it is not cross-allergic with aspirin. Yes, that's correct. It is not. So the one that is not true regarding acetaminophen is that it has anti-inflammatory properties. And this is a reworded version of the preceding question, just asking what you know about acetaminophen. Nowadays, I think they would also put something about liver damage in the question as below. And remember that acetaminophen is also associated in big amounts with liver damage, uh, methemoglobinemia, and hepatotoxicity characterized in acetaminophen toxicosis. The most prominent acute toxic effect associated with acetaminophen use is hemorrhage, renal necrosis, hepatic necrosis, gastric ulceration, or respiratory alkalosis. Again, the most prominent acute toxic effect is associated, with acetaminophen use is, the answer here is hepatic necrosis. Remember, acetaminophen is an aspirin alternative. Alternatives, um, the questions that the answers of hemorrhage, gastric ulceration, and respiratory alkalosis are questions that would have to be to do with aspirin, but not with acetaminophen. The popularity of acetaminophen as an aspirin alternative is because the incident of such effects with this drug is very low. However, because acetaminophen can undergo biotransformation to a toxic intermediate, hepatic and renal necrosis have been reported, especially after very high doses. Hepatic necrosis is the most prominent, especially when combined with alcohol consumption, since the alcohol induces the liver enzymes which make the hepatotoxic metabolites of acetaminophen. So, acetaminophen mixed with alcohol or in very high doses can cause hepatotoxicity. Okay, hepatotoxicity and renal necrosis. So, hepatotoxicity, the most prominent of them. Next, which of the following anti-inflammatory agents does not act primarily by inhibiting the activity of cyclooxygenase? Prednisone. Prednisone does not act like that because prednisone is not an NSAID. And NSAIDs reduce the inflammation by reducing prostaglandin synthesis by blocking the activity of cyclooxygenase. Prednisone is a corticosteroid, and corticosteroids are potent, non-specific inhibitors of the inflammatory process, acting at a variety of points throughout the inflammatory process. Although they do not reduce prostaglandin production as well, they do this by a mechanism other than blocking cyclooxygenase, probably by inhibiting the release of the fatty acid substrate. with prostaglandin synthesis. So corticosteroids do not inhibit cyclooxygenase. Next, which of the following is the most appropriate drug to use to lower a fever in a child under 12? The answer is acetaminophen. Acetaminophen is the best choice. Aspirin is contraindicated due to the potential of, causing Reyes syndrome. Ibuprofen is approved, but usually not the number one choice. The others would be inappropriate as well. Salicylate is just like aspirin, and diflunisal, I think also. Let's say diflunisal. Diflunisal is a non-steroidal anti-inflammatory drug. Okay, so again, which analgesic from the following list has the longest half-life? Diflunisal. Diflunisal can be taken twice daily. The other three, 4 times a day are required. Diflunisal is a long-acting, non-steroidal anti-inflammatory drug that is effective for treating pain, fever, and inflammation in the body. Uh, it's similar to Motrin, to ibuprofen, indomethacin, and naproxen, and nabumetone. Okay, they work by reducing the levels of prostaglandins, chemicals that are responsible for pain and inflammation. It blocks the enzymes that make prostaglandins. This is cyclooxygenases. So there's lower concentrations of prostaglandins. So